Back pain is very common and it can happen for a variety of reasons. It may sneak up on you with prolonged sitting, come on suddenly after using poor body mechanics, or it may result from normal wear and tear as you get older. Lifestyle factors play a role too. Stress, smoking, excess body weight, and inactivity put you at greater risk for back pain. If you have back pain, you're not alone. Nearly 80% of people will experience back pain at some point in their lives. When we use our bodies or sit and stand for long periods of time, it can cause wear and tear on our joints and tissues. Wear and tear is often referred to in terms like disc degeneration, disc bulge, or degenerative joint disease. These are normal, age related changes to our bodies and are rarely the cause of pain. Since the majority of back pain is not caused by structural damage to your bones and tissues, imaging tests like X rays and MRIs are rarely necessary. It's important to realize that pain is your body's way of getting your attention and telling you to make a change. Your body has a network of nerves that carry messages between your body and your brain. Your nerves monitor different parts of your body and work like an alarm system to warn you and your brain of potential threats. If your brain senses a threat, it produces pain to tell your body to take action. Pain isn't something you need to be afraid of. Instead, think of pain as a signal to make a positive change. With effective self care, back pain can often be improved within several weeks. There are simple and effective ways that you can treat your back pain at home. These include healthy lifestyle changes, exercise, healthy posture and body mechanics, self traction, and ice and heat. First, being mindful of your overall health and wellness is important for reducing pain. Make sure to stay active, eat healthy food to maintain a healthy weight, get enough sleep, manage any chronic conditions, and stay up to date on preventive health screenings. Taking these steps will help you feel your best. Staying active and continuing to move within a pain free range are particularly important for reducing back pain, since this promotes circulation, which helps with healing. After an acute injury, a few days of rest may be recommended, but too much rest can actually make your back pain worse and delay your recovery. Research shows that any kind of movement helps reduce back pain. If you haven't exercised in a while, don't try to do too much at once. Work up to 30 minutes of moderate exercise at least 5 days per week. Choose activities you enjoy, such as walking, biking, swimming, dancing, or yoga. In addition to these activities, there are also some exercises that will help relieve pain and make it easier to perform your daily activities. These exercises include pelvic tilts, abdominal bracing, and trunk rotations. To do pelvic tilts, begin lying on your back with your knees bent, feet resting on the floor or bed, and hands on your hips. Slowly tilt your pelvis to flatten your back against the floor or bed, then tilt it back to neutral, then tilt it to arch your back. Repeat these movements. Make sure to concentrate your movements only on your pelvis. To do abdominal bracing, begin lying on your back with your knees bent, feet resting on the floor or bed, and your fingers resting on your stomach just above your hip bones. Tighten your abdominals, pulling your belly button in towards your spine. You should feel your muscles contract under your fingers. Hold this position for 5 to 10 seconds, then relax and repeat. Make sure to keep your back flat against the floor or bed and do not hold your breath as you tighten your muscles. To do trunk rotations, begin lying on your back with your knees bent and feet flat on the floor or bed. Slowly lower your knees down to one side, hold for 5 to 10 seconds, then return to the starting position and repeat on the other side. Make sure to keep your back and shoulders flat on the floor or bed. Start by doing at least 10 repetitions of each exercise every day. Add a few repetitions every few days until you can do 15 repetitions of each exercise. If these exercises make you feel better, consider it a green light to continue with the exercise, but remember not to overdo it. However, you may experience some discomfort with these exercises. If you notice an increase in pain, consider it a yellow light and proceed with caution. If you notice worsening pain with these exercises, consider it a red light for now. Stop the exercise and move on to the next. Remember to try the exercise again later that day or the next day. It's important to keep your body moving within your pain-free zone. Take a moment now to pause this video and give these exercises a try. Using healthy posture and body mechanics will help you move with less pain and get around more easily. It's important to be mindful of your posture while standing, sitting, sleeping, and moving around. Healthy posture means staying relaxed in comfortable alignment with your ears, shoulders, and hips in a straight line. Stand tall, keep your ears over your shoulders, and hold your shoulders back and down. Try propping one foot on a stool to help ease pressure on your lower back. When sitting, sit up straight and relax your shoulders. Place your feet flat on the floor, shoulder width apart. You can use a small pillow or towel roll to support the natural curve of your back. Find positions that are comfortable, but don't stay in one position for too long. Take breaks to move and change positions at least every 20 to 30 minutes. When sleeping, your head should be level with the horizon. Use pillows or a rolled towel to support you. For back sleeping, place a pillow under your head for support and another pillow under your knees. For side sleeping, tuck a pillow into the base of your neck and place another pillow between your knees. When getting out of bed, use the log roll technique. Bend both knees up so your feet are resting on the bed. Then slowly roll to your side as you ease your feet over the side of the bed and push with your arms to sit up. To lift an object off the floor, position yourself close to the item with your feet about shoulder width apart. Pull in your belly button to stabilize your spine and squat down by bending your knees. Pick up the item, keeping it as close to your body as possible. When moving the object, be careful not to twist your body to turn. If you need to change direction, take small steps with your feet. Self-traction techniques relieve pressure on the spine by unloading and relaxing the back muscles. You can perform self-traction while standing or sitting. To do self-traction while standing, lean forward over a chair, countertop, or table, supporting part of your weight through your arms. Hold this position as long as it's comfortable. To do self-traction while sitting, place your hands on the chair armrests or on the seat. Push up with your arms until your bottom slightly clears the chair. Hold this position as long as it's comfortable. Unload your back frequently throughout the day, as often as every hour. Using ice or heat can also help you find some relief from back pain. For long-standing pain or discomfort, you can try either ice or heat and use whichever one works best for you. For a new onset of discomfort, ice is typically best. Use an ice pack wrapped in a towel to protect your skin, and for heat, use a heating pad on a low or medium setting. Use the ice pack or heating pad for 10 to 15 minutes every 2 to 3 hours. Now that you've learned about management of back pain, create a plan of action. Start doing the exercises throughout your day and choose at least 3 of the other strategies to work on at home for the next couple weeks. If your symptoms do not improve, it could be that your body's alarm system has remained sensitive. When this happens, it only takes a little bit of movement, activity, or emotional change to activate your sensitive alarm system and cause pain. This doesn't necessarily mean that your body is in danger. It just means that your nerves have changed the way they respond to normal sensations, making your brain more sensitive. If this has happened, you can learn to calm your nervous system and train your brain to dial down the pain with activities like aerobic exercise, meditation, relaxation, deep breathing, goal setting, and improved sleep. If your pain has persisted for a while, try incorporating these activities into your routine. Remember, if you take care of yourself, you can reduce or even eliminate your back pain in just a few weeks. Staying healthy, exercising, being mindful of your posture and body mechanics, using self-traction techniques, and applying ice and heat can go a long way in helping you find relief. View this video as many times as you like. If you still have any questions about back pain, contact your healthcare provider.